So Doc, I'm very curious on this one. Frozen shoulder, especially for an autoimmune podcast.
Right. You would never have thought that.
I would never have thought that. Yeah.
People that also have autoimmune conditions like RA or thyroid issues are more prone to getting a frozen shoulder. So when you start to take apart and look at the reason why this is more of an autoimmune issue versus just a physical issue, you start to see patterns, right?
Yeah.
So the fact is women do get it more than men. Women do have more thyroid issues than men. And if you were to measure thyroid levels in patients with frozen shoulder, you're going to see way more of them having issues. Yeah.
That's
I like that you brought up
that
there's no adhesive capsulitis with the hip. That's interesting. That's an interesting statement.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code, episode 31. Today, we are attacking autoimmune conditions using regenerative medicine services such as stem cells, exosomes, those kinds of things. We're going to talk all about that. Really, what we're here to talk to you guys today about is not only does stem cells help these conditions, but they're incredibly safe and they work very well at not curing, but enhancing. And that's definitely something that a lot of people get confused on. But these services are very helpful for helping manage the symptoms of these conditions that we're about to talk about. And we're super excited to bring that to you guys today. So as always, I'm Dr. Addy.
And I'm Dr. Jace. Yeah, today we want to dive into a few of these most of them more common conditions that people may experience, and some that may have not found relief from the general medicine and practices thus far.
Yeah.
And this opens up a whole discussion and avenue for some of these patients that maybe have had lack of relief. So today we're going to bring up diabetes type 1, 2, and how certain regenerative therapies can help with that. We're going to talk on MS, multiple sclerosis, SLE, lupus, if we will. And then also we're going to dive into a little bit of frozen shoulder and some of the specifics that you may not realize with adhesive capsulitis or frozen shoulder. So we're excited to touch on that as well. So Doc, let's dive into diabetes. I know it's very common, unfortunately, and differences between type 1, type 2. Type 1, usually you're born with, or it's diagnosed early on in life. Type 2 is acquired via nutrition and energy output or lack thereof. Doc, let's dive into some of the briefs, and then let's see how some of the research has fallen with regenerative therapies.
Absolutely. So with type 1 diabetes, like Doc said, you usually are diagnosed with this early on in life, but you can acquire it over time if, sometimes it can happen. It's usually much more rare. But what you state it as is it's an autoimmune disease which attacks the pancreas, specifically the beta cell, which produce insulin, which is why diabetics need to inject insulin when you have this issue. What they're trying to figure out, is there a possible way to help enhance the production of insulin, if any, so that you don't need to either inject insulin as frequently, or can you get by with a lot less than you normally are injecting? And that's the hypothesis moving forward with stem cell treatments. Not only that, can you take cultured stem cells that have, what they are doing is they're taking the beta cells and creating stem cells from them. And then can you transplant them into the pancreas? And then will they create a new, healthier tissue that puts out insulin?
Wow.
And of course, there's a lot of issues that might arise when doing these kinds of procedures. So we'll get to that in just a little bit. But I think what a lot of people don't realize is we are starting to develop these protocols for organ systems. And for all we know, we might be able to create or grow new organs within the next 10, maybe 20 years. I don't know. But it's exciting to think that we're starting to see the research come out regarding these kinds of procedures. And only if we can get there sooner, because of how much I know how difficult. I have a very close cousin of mine who had diabetes type 1, and growing up, I saw just that effect it had on his life, and just the difficulties that I wouldn't say that it changed him by any means. He still lived, I would say, a pretty normal life, but obviously he had to manage his life a lot differently than maybe most kids did. He had to be cognizant of what he ate, and he had to make sure he injected insulin appropriately, and he had to understand how to do that and why. And if he didn't, the side effects and the symptoms that he'd have, and all of those other things moving forward. And it's unfortunate that these kinds of conditions exist. So if we have any ability to impact that in a positive, substantial way, I hope we can get there as soon as possible. But what I found to be interesting, just briefly here before we dive into the research and how stem cells are helping diabetes, is early introduction of cow's milk or gluten in infancy, or a lack of nutrients like vitamin D, actually may influence the risk of developing type 1 diabetes. Mm-hmm. We're still trying to understand the etiology, pathophysiology of why or how type 1 diabetes happens. Genetically, there's a significant role, the family history of it, there's significant impact, and certain environmental, even viral infections can initiate this attack on the beta cell. Really, where it can be prevented is going to still be a cause for research. But again, most prone, you're going to see it between early ages, maybe anywhere from 4 to 7 years old.
So, Doc, I also saw that even with some of the dietary conditions, whether it's type 1, type 2, they even found that sugar and high processed foods in younger individuals have also induced and had a higher risk of diabetes. Whether that's if you're feeding your kids McDonald's, it will have such a huge effect on their brain, especially when a huge part of neuroplasticity, or the growing and learning and expansion of these neural connections, are growing into even like the early 20s for most individuals. So what you put into your system, the environment you surround yourself with for diabetes matters just as much. And I know what you brought up too, in terms of stem cells, they're enhancers of the healing process and the neurological influence throughout the whole body. Doc, for the clinical manifestations, how certain therapies have been utilized for diabetes, what do those look like? And then how does that change from stem cells?
So most of the time you're going to have an uptick in cardiovascular health issues, maybe possibly kidney issues moving down the line. You're going to see changes with feet or extremity health, neuropathy, feet pain, those kinds of things. And just overall healing ability is reduced when you have diabetes. That isn't managed very well. Of course, the main one is issues with blood sugar management. That's the primary part of the disease. So the way it's managed is with either short or long-acting insulin injections, and just the management of when to introduce that post-meal and making sure that you're regulating your blood sugar levels appropriately is the main struggle or condition of type 1 diabetes. Right now, they're getting to the point of a lot of patients have wearable glucose monitors. They just use their phone, tap, and they can get an instant reading, which back in the day, you used to have to prick your finger, drop the blood on the monitor, and it took a little longer. Obviously, no one likes to prick their finger. I didn't. I hated it when I monitored my glucose. And then now you'll have insulin pumps that just sustain a more steady flow of insulin, or you can inject just by keeping the insulin vials in the pump, and then you just program it to inject a certain amount for you, and that's
cool.
that's a little easier, and especially for children who don't want to draw up the insulin and do those kinds of injections either. With that moving forward, there really isn't, I guess, too much change with how things are being managed, other than the prices of insulin are going up, and it's still very expensive for these patients to have to manage, unfortunately. Gosh, I want to say even back in the day, it was thousands of dollars a month for insulin
Wow.
for these patients. You could see the issue of, well, this is something that they were born with. It's not their fault. And the fact that they have had to now invest that kind of money into their health without any real coverage, it's unfortunate. It really is unfortunate.
Absolutely. So in terms of emerging therapies, because I know not much has changed, but I know we touched on briefly and how certain, whether it's stem cells or whether it's different transplantations, what does that look like? Because I've heard even before a pancreas reimplant and how that can affect the immunology as well as the whole thing
Right.
itself. But
So they're working on trying to find a way to build an artificial pancreas, and if they're at all possible, implanting it into a human. Now, if they can pull it off, it might eliminate this issue for patients, but you're going to have issues with rejection and, of course, keeping the pancreas alive and viable. I think the first pig kidney transplant was done last year, 2 years ago,
no way.
and the patient lived 6 months longer, or he was alive for about 6 months after, and
Okay.
he was on his deathbed when they did it. He might have had a
Decent.
couple weeks left. It had not had the implantation. We know that
Okay.
we can, with certain organs, we're going to have more luck, unfortunately, with the pancreas. I think it's a lot more difficult, but really what you can try to do too is, instead of implanting a full pancreas, trying to then heal the cells that are damaged internally to try and then create a more positive output of those cells. And that's exactly what the implantation idea of stem cells is getting into, is trying to take these primed stem cells that can heal beta cells or replace the beta cells to put out insulin. That way you don't need to inject it anymore. But again, it comes with making sure that the stem cells are staying alive long enough to create not artificial, but the cells that should then be replaced, and then they should continue to live long enough and become a part of that ecosystem or that system of the pancreas. So,
Because those stem cells, when they're applied, they can only last for anywhere from
days
hours
to week, yeah.
days. Okay.
And
Yeah.
sometimes hours, it just
Yeah.
depends. And if you're fighting rejection and the immune system and all of those kinds of things, you're gonna come up with those kinds of struggles as you do these treatments. So the question is will you have to continue to get implantations? Is it just a one-time thing? What is that going to look like? Further research will tell us. But
Are they projecting to implant or inject that straight into the pancreas, or has it been shown like externally for target?
it is implanting directly into the pancreas. And a lot of it is still very much in the hypothesis phase, but cell culturing done in vitro, those kinds of. But what's great is they've seen positive outcomes doing these kinds of research on cultures. Question is, how soon will we be able to use it on humans, and what will that look like moving forward? But right now, we are seeing research done on type 1 diabetics with stem cells done intravenously.
Ooh.
And it's definitely showing, like we talked about, enhancing of these symptoms. It enhances the outcomes that these type 1 diabetics are having symptomatically. For the first trial that I pulled up, it was a phase 2 randomized double-blind placebo-controlled trial. And the aim was not to assess only the efficacy, but safety, which is, again, I'm always looking to see how well we can document safety when it comes to these procedures. They looked to see, could you preserve endogenous insulin producing cells with those who just were diagnosed with type 1 diabetes? And then what kind of symptom change came about after the procedure? It was patients between the ages of 18 and 40 that were just newly diagnosed with type 1 diabetes, and they were measuring what's called C-peptide levels. And so when your body turns what's called proinsulin into insulin, the byproduct is C-peptide. So you can measure C-peptide levels to tell you, is your body producing insulin? via the byproduct.
Makes sense.
So they measured C-peptide levels to see, okay, is the body still producing insulin? As fortunately as now beta cells are being killed, you aren't going to see as much C-peptide being produced.
Yes.
So that's the way that they measured it. And then, of course, they were able to look at the insulin requirements needed to manage the patient's blood levels. So how much insulin was being introduced into the body, and did that reduce or improve in this study?
Wow.
What they found, C-peptide levels were, in the placebo group, declined about 47% over the year, meaning the body was continuing to attack the beta cells and you were producing less insulin, meaning producing less C-peptide levels. In the stem cell group, it declined only by 10%.
It's a huge.
So what they
huge
showed
area.
was preservation of these beta cells. Or other hypotheses would be continuing to signal appropriately, regeneration, all the things that we talked about in all the other podcasts. So
And this was intravenously. This was
intravenously. Yep.
Okay, so obviously through then IV having positive effects to keep these beta cells alive for longer.
Yep.
Opens up the door to, well, yes, it can help through the whole vascular system, but going even straight into transplantation or straight into the pancreas, obviously there's more research that needs to be had with that, but has there been other studies that you've found for that purpose?
Yeah,
then?
and they've done quite a few. The next one that I have here was done on both type 1 and type 2 diabetic patients. So
Even better.
we got to see
Cool.
even what that outcome was for those patients as well. But this was a meta-analysis on type 1, type 2, and it was, I believe, at the end of the exclusion was about 239 patients.
Wow.
And they looked at hemoglobin A1C levels, fasting C-peptide levels, which again, we talked about what C-peptide was, insulin requirement, which is just, again, how much insulin is needed to manage blood glucose levels. And then they also measured safety, which is always, I love.
Beautiful.
And the findings were, for hemoglobin A1C levels, stem cell treated groups showed a significant reduction in hemoglobin A1C levels compared to baseline, indicating obviously that this was super effective at lowering hemoglobin A1C. And for those who don't know, hemoglobin A1C is just almost a picture of what your blood levels have looked like in the past 3 months. So we were able to lower hemoglobin A1C. The second thing was fasting C-peptide levels. The stem cell group had higher C-peptide levels, meaning again, ability to create insulin by naturally was improved compared to control group. And lastly, they found that the stem cell treated group experienced significant reduction in insulin requirements, meaning they didn't have to use as much insulin to manage their blood sugars.
Ooh, wow.
And so this is for both type 1 and type 2. But there was a noticeable decrease in the need for external insulin in type 1 patients.
Wow.
Safety, no significant adverse events was associated, obviously suggesting that the treatment is generally safe. So
Opens up the door.
what does this
Where we wanna
mean for
go.
patients is maybe a better question too, is first and foremost, if it's recent and you're just getting started with the current management of this, you might be able to prolong the destruction using this product. Now, for how long, I don't know. We definitely have to do a lot more long-term study following up, but the first study I showed was a year.
Yeah.
They were able to. So can you get on a routine injection for the rest of your life? And is that feasible? I don't know, but these are all the questions that I think I would have moving forward. And what would I do if I wanted to manage my life appropriately and not have the worsening effects of this autoimmune condition? That's really what I would think about moving forward as someone if I were to have this diagnosis come upon myself. And the last study I have really showed the same things as far as the ability for C-peptide to be preserved and fewer episodes of hypoglycemia or loss of blood sugar. Yeah, that was really the last study. And I'll just put that up there for those of you to see. But again, those are super exciting to see the effects that stem cells may have on this condition moving forward, and just the ways that we have not been able to manage this. And now we might have some really conclusive evidence to show that preservation could be possible and
it opens up the door
Exactly.
for more research, especially with how promising it's been for intravenous application, for implantation.
Yeah.
Not only symptoms, but they're even seeing physiology-wise for the C peptide. So that's fascinating. I'm excited to see what comes down the road from there. And I like the point that you brought up to put in our perspective on it. If you were in the same position as well, what would you do in this situation? And with little to absolutely no adverse effects, it only makes sense to potentially look to do this long term, maybe on a case by case management with that. But man, that's fascinating. Okay, now we know diabetes and that it can potentially help there, and there's definitely more research that needs to come. But then opening up to other conditions, so multiple sclerosis, MS, and how it can impact the central nervous system. Do you want to dive into that and how that condition can demyelinate the nerves, thus affect a bunch of other systems systemic wide?
Yes.
And stem cells, how does that play into it?
So when it comes to patients with multiple sclerosis, the first thing that you'll want to understand is when the body starts attacking the myelin, which surrounds the nerve fibers, you'll see this breakdown in communication almost. And that can come with a lot of other symptoms, and I can get to those in a little bit. But the first thought process was, okay, the body just started attacking the myelin, and that's just an unfortunate reason or instance of why this is going on. And there's not a lot of exact understanding of why MS happens. But what we recently just came out with, studies are showing that more than likely it's due to viral infection. And which viruses, more often than not, the Epstein-Barr is the one that they're trying to focus on mostly. If not, it's human herpes virus 6 and varicella zoster virus. Those are the ones that they're looking into. But I think moving forward, knowing that it's more of a viral infection, it can be managed differently. And I hope that we can come up with the approach of managing that versus just thinking that this is just something that you're going to have to deal with. Is there any way possible for us to figure out how to manage the viral load? And will that make a change down the road for these patients versus just this acceptance of, oh, this is what you're going to have to live with kind of an idea? So with patients that have MS, you're going to see changes with motor symptoms, sensory symptoms. You might have issues with vision, cognitive symptoms, fatigue, bowel bladder dysfunction, emotional, psychological symptoms. It can really affect quite a large amount of systems of the body. Again, we are driven by nerves and nerve fibers. So anything in the body is affected by nerves. So we're going to have obviously a widespread systematic effect. Now, those who are most prone to MS, typically between 20 and 40 years old, women are more likely to develop MS than men. Family history of MS is associated, so genetics will play a part of that. It also showed those who have vitamin D deficiency, as far as research showed a correlation to having MS as well. That's the nuts and bolts of MS, but the more interesting part is what's being done to try to manage this issue. And it's right now trying to come up with a concoction of medication is the best that they have. So many oral medications are being created to try and manage just symptoms of fatigue, symptoms of pain, symptoms of spasticity. Physical therapy is always involved. I know speech therapy, occupational therapy, all these things to just try to manage the symptoms as they come, really.
Yeah.
But the actual moving forward to try to affect it systemically to either hinder or prevent any further degeneration, we still have a lot of research to do. But the emerging research that we have so far looks promising. And I think, again, with just how these last podcasts have gone, just showing how safe these treatments are, again, I wouldn't hesitate to look into this. And just coming up with the first study here, it's a phase 3 trial. So this was very advanced, far along in the stages of a trial that has been done on any form of stem cell treatment. So this was hematopoietic stem cells, which are derived usually from blood. And 110 patients who have relapsing, remitting, or secondary progressive MS were involved in this study. It was a 2-year study. So with patients that received the transplantation of stem cells, showed a significantly higher rate of relapse-free survival compared to the control group, which was 85% versus 47% at 2 years. There was also a huge improvement in disability progression. There was fewer new or largening lesions on MRI and slower progression of disability compared to the control group. However, because of just how advanced this procedure was, there was serious adverse events associated with this, but the overall safety profile was considered manageable with proper medical support. And with the kind of administration of stem cells that this gentleman was doing, these patients had a very, tempered immune system. So he was trying to manage that as well as he could. But this is, I would say, really the only studies that I'm about to bring up again with Dr. Burt, because these are both Dr. Burt's studies. There was an amount of invasiveness to these kinds of transplantations. So that's where you're going to have, unfortunately, a little bit more side effects. But with the general consensus of intravenous stem cells, especially mesenchymal stem cells, these are hematopoietic stem cells, you're going to find way less side effects, if any. But the second study was done on 145 patients. This was a 5-year follow-up. Again, the relapse-free survival rate in the stem cell group was 78% versus 50% at the control group after 5 years. Some, again, serious side effects were associated, but again, the incidence of these events decreased over time with improved management strategies. So really what we have here is the first ever implantation of stem cells ever done on a MS patients. And it showed great results. Unfortunately, it is some risk with this kind of implantation, but what you're going to find is you have either that or a lifetime of just concoction of medication to try and manage these symptoms.
Even with their immune system already compromised itself, that adds in so many other variables to where, yes, it's probably helping to a certain extent, but maybe as it helps one area, it forces the body to spend resources that it may not have for another area, and thus an adverse reaction potential. And I know for some of the newer studies with MS for stem cells, this is 2019, 2020. So we're still early on. I think that opens up a whole area to improve certain conditions like MS, but that's why it's important to have a practitioner that is monitoring this, that is very familiar with stem cells and the type that they're giving for certain conditions, MS or non-MS. So Doc, I'm very curious on this one. Frozen shoulder, especially for an autoimmune podcast.
Right. You would never have thought that.
I would never have thought that, yeah. But there's certain things that you brought up when we were talking off camera that, and I don't want to say the first time I'm hearing it, it's been probably since graduate school, but I just don't think about it on a consistent basis when it comes to frozen shoulder or adhesive capsulitis. Same thing, just different terms. Let's dive into the specifics of what is frozen shoulder, how can it occur, and then what are the ways that we're managing it, and then how can Regenerative therapies help with that?
For sure. So with frozen shoulder or adhesive capsulitis, the first thing that you'll want to understand is we're still trying to understand how it happens. And there's some theories. The first one is what we call the inflammation theory, where there's just this period of inflammation that leads to fibrosis and thickening of the capsule, and that's where this process is then started. And with frozen shoulder, there's a few stages that we'll get to, which clinically then you're used to diagnose. But this inflammatory process is thought to be triggered by injury, surgery, or it could just come on out of nowhere. We really don't know. The second theory, in my opinion, is the far more interesting and accurate, in my opinion, is the autoimmune theory. And that's where the body starts attacking the capsule. And we then see this breakdown in the shoulder health. There's a couple other theories. I don't really need to. One is immobilization, where you don't move it for very long, either after surgery or injury. That could also lead to contracture of the capsule. So what's interesting is frozen shoulder commonly affects women more than men, and women tend to have more thyroid issues than men. So that's the first theory. People that also have autoimmune conditions like RA or thyroid issues are more prone to getting a frozen shoulder. So when you start to take apart and look at the reason why this is more of an autoimmune issue versus just a physical issue, you start to see patterns, right?
Yeah.
So the fact is, women do get it more than men.
Mhm.
Women do have more thyroid issues than men. And if you were to measure thyroid levels in patients with frozen shoulder, you're going to see way more of them having issues. When you take a look at how do we manage this patient's thyroid levels, start putting them on an autoimmune kind of diet and attack it that way versus just simply structural, I think you're going to find more of an outcome doing it that way. And you might actually lower or reduce the amount of time or days of this condition having symptoms, because we know that frozen shoulder can take a very long time to heal or to move through its stages in a way. So the typical stages would be freezing, frozen, and thawing. Freezing can last anywhere from 6 to 9 months. It's again just starts getting stiffer. Range of motion starts to decrease. You usually start to lose abduction and external rotation first. Frozen, where it's very stiff, very difficult to move, that can last for another 4 to 12 months. And then thawing stage can be months to years, where the shoulder starts to unthaw, you start to get more movement back, and then it's typically resolves. But the fact that it could take years to get through this process is scary. And if there's a way to shorten this time of symptoms, it's going to be very helpful for these kinds of patients. Now, Doc, I know we've talked about frozen shoulder in the past, difficult ways that it can be managed. Obviously, physical therapy is super helpful, but I know we even talked about laser and hydrodilation and all the other ways that we've looked into too, but non-surgically, where have you looked as far as or helping with the restricted capsule and making changes there?
Absolutely. So when I think of adhesive capsulitis, I think about it as like an inflammatory reaction of the joint capsule. And if there's any problem with any joint capsule, it's going to cause overlying muscle guard. But even moving back into reaching behind them, then it involves the humerus to bring the humeral head to the front part of the capsule, which then restricts and causes even more inflammation, thus the guarding itself. So the ways that you can get about that is getting more, either one, fluid in the area, but then two, making sure that you are not activating the tissues, because anytime you activate a tissue and then move it, especially concentrically, eccentrically, or bringing the one joint or tissue or body region closer to and apart, can cause a friction between the tissues. So when that happens, when the joint is already inflamed, you want to make sure that you can go about therapeutic exercises without increasing inflammation. So thus why certain physical therapy practices have a dowel or stick to where you control the movement with the other arm, and then you go to angles and areas without the use of the arm that has capsulitis. That's where you can get to the restricted area. You force an light isometric contraction, or just squeeze of the tissues, 10 to 15 seconds on and off, varying the intensity. You're able to send a signal for the body to start the repair process. There's a hormonal signal as well, and that can accelerate from a physical therapy standpoint. But I think there's also other ways. I know we touched on this previously in the past podcasts with Josh. The laser therapy can break down a lot of the inflammation. I know sound wave therapy can do a similar thing as well. So there's other therapies that I think absolutely need way more research, but can have influence for the symptoms and accelerate the stages. But even in addition to that, there is a condition of internal state causing this inflammation that we don't 100% know, but I really like your point in terms of the influence from the thyroid, influence from any of the other brain centers will also have an impact to the shoulders as well. And that raises the question, why don't we have adhesive capsulitis in the hips or any of the other large ball and socket joints? Well, there's certain neurology that we know that there's connection between the upper traps, bottom portion of the neck, which goes to the main brainstem. Maybe theorizing, of course. Maybe there is a connection between the shoulders and midbrain and or thyroid that we may not realize or haven't come to the conclusion yet from a medication or medical field standpoint.
Yeah. I like
That's
that you
kind of
brought
my
up
2
that
cents, but
there's no adhesive capsulitis with the hip. That's interesting. That's an interesting statement.
because that's probably more used than it is shoulders.
Yeah, for how much we walk and things like that. But the arms are closer
Mhm.
to the brain and thyroid, and
Mhm.
who knows?
It's a really tough question, and I know we manage it a couple different ways. Like corticosteroid injections definitely can help relieve. That's usually a good go-to for most MDs, other practitioners, but to treat the root cause, I think you're just treating the symptoms more so, which we are to a certain extent, but with new evidence and research coming down the line, especially from stem cells, that I think it's going to open up a whole nother avenue and pathway.
Well, and we already know that steroids are degradative in their nature. So yes, getting them is going to help with the pain, but we're already dealing with a capsule that's breaking down. And so that's only going to add to the worsening of that effect when you put steroids into that environment. That's why, again, the idea of putting stem cells or something that's going to create healing versus break down the tissue is going to be so advantageous. So with the first study that I have here, this is patients were diagnosed with adhesive capsulitis around the ages of 40 to 65. There was 200 patients in this study. It was a 12-month study. They were using pain and function scales to make sure that they were going to be assessed. They also measured range of motion and other types of secondary endpoints to see what that looks like after the study was done. And they also measured how safe the study was after induction of the stem cells into the area. When they measured pain and function scores, they found the stem cell group showed significant improvement in both pain scales and what was called the constant Merley score, which is a function scale compared to the placebo group. The stem cell group demonstrated a greater increase in range of motion and reduction in stiffness and functional limitations at 12 months. And of course, stem cell therapy was well tolerated. There was no serious adverse events reported. The only real mild side effects were soreness at the injection site and some mild swelling, which is what I tell everybody when they have this treatment.
Wow.
This is really great that we have more and more body of research for not only stem cells, but for obviously these conditions. And as we continue to build up more and more of these studies, which if you want to wait till we get to that body of research, go right ahead. But with what we've already seen moving forward, that's why I feel so comfortable having patients try this without really any fear, because we have documented this time and time again with all of these studies, at least mesenchymal stem cells. And I know with the MS, that was hematopoietic, so it's a little bit different. But really, there is no reason to be concerned trying this treatment, assuming you've exhausted the other efforts and you're looking for something else. But
And that study was with, you said mesenchymal?
Yeah, that was mesenchymal. So bone marrow, mesenchymal. The next study with bone marrow stem cells as well, but this was actually compared to physical therapy. So it was a different control group, treatment group, I should say.
Yep.
150 patients, ages 35 to 60 were included, divided into 2 groups. You had your standard PT versus bone marrow stem cell. 6 months post-treatment was the follow-up. They looked at what was called the American Shoulder and Elbow Surgeon's score and numeric rating for pain. So again, pain and function scores. They looked at range of motion again, and they looked at stiffness-related secondary outcomes. Now, what they found was in the stem cell group, statistically significant improvements in both the pain and the function scores compared to the PT, just alone. They also found range of motion and any stiffness related to secondary endpoints were much more improved than PT.
Boom.
And procedure was well tolerated with minor side effects, including transient discomfort at injection site and minimal swelling. Again, so
makes way more of the effect of the inflammatory response. You get that under control, everything else can come down.
I think that's right. So we talk about why stem cells work so well. Immune modulator. They have the ability to modulate that immune system, reduce inflammation, improve the environment at hand. Not only that, but it probably is also recruiting cartilage cells to chondroblast to improve cartilage, we might be seeing change there. And of course, just all the other positive benefits that you get from stem cells. That's where you're going to have that ability to make change. Now, not to say PT isn't amazing for how many other several conditions.
We love PT.
It's just that why is it that PT tends to fail with this condition?
Exactly.
Because I know we've seen it how many times. These are very difficult patients to manage. Their condition just for some reason, we don't see the results we want to when we start trying to take apart from that therapeutic PT side, chiropractic, laser, all of that.
If you throw the whole kitchen sink at it, it's very minimal.
For some.
Yeah.
So now you introduce something that actually affects the immune system from that point of concept. Makes sense why we maybe are getting the changes we are.
Fascinating. So going back to your point with the thyroid and that connection, what were you stating about the thyroid itself with those? Or is it more just similarities with those patients?
So
frozen shoulder.
With patients that have autoimmune conditions, such as a very common autoimmune condition is Hashimoto's. So it's already attacking the thyroid, unfortunately. Now, what we see is they tend to come in bunches. If you have one autoimmune condition, you're going to have more. That's just the general consensus. It's very common to see patients who have an autoimmune disease to have several systems affected. That's just that kind of consensus. But the most common one is the thyroid. So that's where you look under the box and you see that. It's not too confusing to see frozen shoulder now a part of those patient subsets.
Okay.
And that's where you can, again, look at patients with RA and other autoimmune issues also getting frozen shoulder.
Okay, that makes way more sense then. Okay.
Expect the inevitable when you see this pattern. And obviously you want to manage the patient appropriately. You want to make sure that if you're going to come at it from a actual immune system approach, which if you manage the immune system and make sure that you can reduce flare-ups, you can reduce any other symptomatology, you might prevent or even enhance any other of the symptoms that they're having, whether that's an autoimmune diet, whether that's managing thyroid levels, whether that's eating healthy, moving, all the other things that are, of course, going to enhance their health. That's the approach you should take versus just chasing what's going on at the time.
To me, this almost stands out as this is almost a primary, and I don't get swayed by just one study too often, but that just the difference between PT and stem cells for especially frozen shoulder opens up my mind. And any patient I feel like has a frozen shoulder, I'm almost going to absolutely recommend stem cells. You might as well target at the root cause and source instead of covering up the symptoms and you're going through a cycle for potentially years.
Yep.
That opens, oh man, thank you for that.
Yeah. And really the last major autoimmune disease that patients struggle with is SLE. I haven't worked with a lot of patients with lupus, I think maybe a handful. And the changes that I saw were minimal, moderate at best. But this condition is very unfortunate. It can affect multiple organ systems. And I know a lot more research is needing to be done on this condition with stem cells. But some promise, especially with some of the inflammatory markers that they showed, and I can get to the study in just a little bit. A lot of the times you'll find that with SLE, it can attack, not only can it attack the organ systems like the kidneys, the hearts, the lung, but it can attack your skin, your joints, and there are even times down the line where you'll need an organ transplant because it really does damage the organ system so heavily. That's where these advancements and treatments are needing to get ramped up so that we can try to find a way to at least prevent or limit just how much flare-ups they're getting and improving their quality of life. So
and even with this systemic lupus, erythematosus, like it's a miscommunication of the body attacking the healthy tissues of the body. Then you think about this, knowing that, of incorporating stem cells of potentially either foreign to yourself or it's a little different putting that into the body. Theoretically, you would think, is the body going to automatically attack that too? in addition to your tissues, and that's where it opens up this idea of, can stem cells affect SLE? And then that's where we're going to get to the study, but I wanted to bring that up for people that weren't familiar with lupus and how it can attack the healthy cells of the body, and just throwing that into the equation.
Yeah. And really another important part of the literature using mesenchymal stem cells, we have yet to show a reported case of rejection.
Boom.
So that's where the safety portion of it, the theory is you introduce foreign cells into the body, that's what you're going to get. But what people don't realize is when it's taken from the umbilical cord, there has been no what's called privilege to a certain body yet.
Okay.
And so there's what's called low immunogenicity, meaning it has not yet taken a side. So if, let's say, you have this, antigen or antibody in your body ready to defend and protect you, it's already chosen a side in all the cells that you have accustomed to you. But it's the cord stuck between the baby and the mom, and there's no side. It's just meant to help grow and feed. And the immune system really hasn't even been built yet. So that's where a lot of the time people, they question, how safe is this product? How safe are these cells getting introduced? And we still have yet to even see any cases of rejection in the literature.
I can almost think of that as those baby reveals of this white balloon. It's either going to pop out pink or blue confetti. Maybe this is the white balloon.
There you go.
It can choose
just whatever it wants.
Yeah.
And
there we go.
That's funny. But what's really difficult for these patients is they're on an enormous amount of medications. Corticosteroids, biologic agents where you're getting these injections done routinely, and these are heavy immune modulators. These are suppressors, which can make you feel very, very ill. You can get sick a lot easier. You really have no chance to. Inflammation is important not only for sickness, but for healing too. These are just patients that really are dealing with a lot of unfortunate side effects from this disease. So moving forward into the research that we have so far, I think I have two. Yes. And first, the fact that we already have these trials with as large as patients in these trials as possible is great to see. And so 8 studies were included in the first meta-analysis. 3 of them were randomized control trials with 66 patients. And so what they found was 3 things. 1, MSCs led to a significant reduction in SLE disease activity. There was a reduction in 24-hour urine protein, suggestion improved kidney function, and complement C3 levels increased, which is a marker often low in SLE patients and indicates improved immune system function.
Wow.
This was a really great analysis showing the kind of changes that stem cells may have on patients with SLE. Now, again, smaller subsets of patients. 200 sounds like a lot of people, but it's not. We definitely have a lot more research to do. So the other study that I have showed 40 patients taking stem cell transplant intravenously. First off, there was no transplantation-related adverse events reported. There was 2 responses that they measured. One was called major clinical response and one was partial clinical response. 13 out of the 40 patients had major clinical responses. 11 out of 40 had partial clinical responses. So roughly over half saw changes in positive scores with stem cells. This showed 12% of patients had relapse at 9 months and 16% at 12 months following the initial response. It really delayed a flare-up with these patients.
So, Doc, that you brought up that it delayed the whole process of the condition. That kind of, for me, opens up the pathway. Okay, maybe we may have to zone in on the dosaging or the frequency potentially
For sure.
of how to administer this. Because if we start delaying it and you add on time and repetitions to how it's involved and how it's given to the body, theoretically, based on some of the research, it would improve the condition as it keeps going on over time then.
Exactly.
Theoretically.
Yeah. And the question is, of course, how many of these treatments will you need over the
Mhm.
course of your time? But the fact that it was one transfusion with no relapse of at least 9 months for some patients and 12 months for some can be quite substantial, knowing that it's just going to take just a transplant intravenously to make that kind of change. Whereas, of course, we worry about needing to take this or do this treatment more frequently. Obviously, that means costs more money, and it's only going to make it more difficult for these patients to get these kinds of treatments, of course, with this financial barrier. But yeah, all in all, we know that it can help maybe preserve kidney health. It can manage the inflammatory markers that this disease has, and can really help just improve disease activity overall, with at least as an enhancer to what they're already doing. More research again is going to need to be done, but of the conditions that I've researched or even have done in practice, all in all, you're going to see a positive effect when introducing these cells into the body. The question is how much, and what does that look like, and is there a way to get better results, and what is that protocol going to need to be moving forward?
Doc, after listening to multiple podcasts, after taking in all this information, and just it opens up my mind of other conditions of the body that we necessarily prior to this were just covering up the symptoms and trying to help people just get by instead
Right.
of attacking the root cause. It almost seems like stem cells, exosomes, peptides, like they're almost attacking at the root cause locally and systemically is what I'm gathering from this. Obviously, like you said, more research needs to be done on certain conditions for certain populations, but in general, theorizing, of course, but maybe your projection moving forward for the general public, everyone, would there be benefits, no conditions at all, healthy, to influence or give some of these therapies to help enhance the person's function and ability for their everyday tasks?
Absolutely. And of the things that I would notice maybe more improvements on day to day in a healthier subset would be the ability to recover, the ability to heal, and just the general overall feeling of improvements can be anything from cognitive, mental change, feeling less pain, even just, again, feeling of overall wellness, less sick, immune modulation, those kinds of things. But when I was doing it routinely at once a month, I found that I very rarely got sore from workouts. So that was one of the major things that I saw when doing this routinely. Other patients, I know a lot of people who do this monthly, like a lot of high performing individuals. I know Tony Robbins does it every day, every other day. He does it a lot.
Damn.
A lot of other individuals, they go and do injections in every single joint all at once, multiple times a year. And so what I foresee is cells starting to become more like medicine, where you go in and you're getting this cellular intravenous infusion or injection routinely just to help manage the issues that you have. And that's going to become more widestream. It's just a matter of how to make it safe as possible and what that's going to look like over time. But especially for some of these very difficult conditions to manage, I would foresee some type of treatment being you come in, get something monthly, and that only helps to preserve organ systems and manage disease activity over time, versus a very harsh immunosuppressive drug done routinely where, yes, it's managing that part of it, but you still don't get the other parts of it when you're looking at managing this kinds of issues.
So that kind of opens up my mind. So just, and again, theorizing, let's say situation based, you're having a kid, you're going to become a father, male, female, doesn't matter as much right now, but what steps in a perfect world with no limitations from potentially the spouse would you take for that individual and maybe in different stages of their life? So for example, would you want to save certain parts of either the placenta or blood work in a younger individual?
Yeah.
And when would be the youngest that you would look to potentially introduce stem cells into that individual for a reoccurring basis throughout their life?
Sure.
What does your mind go to with some of that?
Yeah, I don't think I've ever been asked that before. First and foremost, there are banks that will store that for you.
Okay.
So if you want to store the umbilical cord and the baby's placenta, all that tissue, there are banks that will do that for you for many reasons. One, if you very rarely, in this case, ever end up developing a genetic disease or a disease of the bone marrow, you now have that available to culture and introduce if they ever need to irradiate that bone marrow for any type of disease or cancer. So
Cool.
that versus not needing a donor.
Okay.
So that is something that I know a lot of parents are doing, where they'll store that for said individual, said child. And if something does come up down the road, which is any of that is going to be needed to be cultured, then they'll have that available. But as far as age goes, I think depending on the kind of issues that this person is having. Now, if it's just a general healthy individual, I would say, and this is probably more of a opinion than anything, unless they really need it, there are plenty of other ways to impact a person's life than this routine injections. But I mean, that's where exercise, sleep, diet, I'm going to voice way more heavily than something like this. But let's say you were to have an issue, let's say an 18-year-old who has a shoulder issue. I would have no problem doing stem cells on an 18-year-old. I had a friend of mine, his son tore his ACL playing basketball, and he was 18, and he went and had his son do the injection. And he found that it reduced the pain and swelling very quickly. He was able to get back to daily life within, I think, 3 days versus, it was swollen and he was hobbling on it. And it delayed the surgery, I think, for a year and a half.
Wow.
Or close to 2 years. Now, the reason that they chose to do surgery was he wanted to still be a competitive and very athletic individual.
Okay.
Structure-wise, they wanted to fasten it. But other than that, we definitely did biologics and PRP on younger individuals. PRP even for Auschwitz-Slaughters. I think we had a 15-year-old. Phenomenal. All it took was one injection, and those symptoms had subsided within 3 weeks, I think.
Did you ever do any before after images with?
No imaging. We should
to see
have.
that.
That was something that we should have done.
Mhm.
We have done plenty of before and afters on the osteoarthritis. And that was to see the actual joint gap change, space regained, plus some of the reduction in sclerosis and other types of things that come with osteoarthritis. You could just tell there was healing activity happening in that area before and after. You could tell the bone was much cleaner, less sclerotic changes, less osteophytic change. And of course, the patient's symptoms were much improved too. But yeah, I think as we move forward into the next generation of tissue engineering and trying to make changes, I think you'll find cells to be starting to replace certain medications. Cellular therapy will replace certain medications. And rightfully, because when you can introduce these primed cells that make changes without real adverse effects versus just how harsh medications are on their liver and other parts of your body, we're outdated in that area. We really are outdated. And if that's the best that we have right now, I can't wait till we do better.
Even us breaking down like the genetic codes, and there's so much information we still have to learn on that front. Yeah. There's professionals and professors theorizing that our genetic code has a lot of the answers already in it. Yep. So you take that into consideration as us knowing that these stem cells are parts of human tissues put back into the body, whether it's platelets, PRP, whether it's exosome stem cells, and how the body can re-heal itself with little to absolutely no adverse reactions. Without a capitalist society, there's only, for me in my mind, mainly one avenue for where a lot of the mainstream medical doctors should be going. But obviously, there's limitations from multiple points of view, and I don't know. I'm just surprised. I am and I'm not surprised that this hasn't been utilized much more. And I'm just grateful that we know just some of the basics of it and that we can continue on from here on moving to the future, which also makes sense of as time goes on, research will get better, results will get better, but then there still has to be that point where the general population needs these therapies.
Yes.
And with less risk, with less costs involved with it. And I think with you doing your whole company and opening up that, it breaks down part of a barrier that opens things up, better humans moving forward. So I'm grateful for you on that one. I'm excited to see how things play moving into the future. But yeah. Doc.
I think too, the U.S. is going to lose its authority on this type of, and we already have a lot of the real groundbreaking stuff is going to be done outside of the United States just due to regulations, which is unfortunate because I really think we could create a huge impact on that space if we were allowed to. And people tried and were sort of evicted from the country and had to move elsewhere to continue these trials and these advances in technology. And so Europe and the America South, Panama, South America, they're Mexico even, they're setting up shop there to create more and more research with less regulations, which it sounds scary, but it's not that it's not regulated. It just means they're able to do these things without the just strict policies that the U.S. has. And I understand why they have them, but again, we're sitting here talking about something that we, from all the effort and we put in these podcasts, understanding just at base level that these have been done on people. It's very safe in the studies that we've shown. You can make some changes that I know we would think you'd want in your life. But the fact is, before we have a conclusive agreement on the consensus of these treatments, you might have to wait 10 years to get that.
If not potentially more with the government.
That's where I do have a frustration because there are people needing this right now and will continue to need this as we move forward. And that's where the gray of healthcare is. I always like to call it. I've always existed in the gray. That's how I've explained it to patients. It's not necessarily something that's illegal because it isn't. Now there are portions of it that are frowned upon by other providers just because they feel there isn't enough inclusive evidence. Now, FDA truly does not want you marketing these products, and that is illegal. They will shut you down for that. But doing these treatments on patients, you are not prevented to practice medicine as a doctor. You can practice medicine as long as the products are not deemed illegal, and these still have yet to be deemed illegal. The only thing illegal about it is the promotion and marketing of them. So that's where a lot of providers, I think, are worried because they think of the boundary barrier of getting into this, and they're worried that they're going to be looked upon as a different way, or they might have some red tape around this. But when you break it down and look at just the legalities of it, you got to understand that you still have the ability to practice as a doctor. It's just as long as it's in your scope and you're not doing what they don't want you to do, you have every right to help these patients this way. And I just hope that there's less red tape around this industry moving forward, because I think we're going to get changes much quicker. We might even be able to cure or remiss a lot of these conditions if allowed.
And save some people's lives. Like some of the stuff we brought up today, the mortality rate significantly decreased with the use of these stem cells. And even going back to that point too, I can't remember the certain percentage, but most medical practitioners or physicians lie in and work for larger corporations, which act as a business. So that's one layer. You have the government, it holds another layer. So there's certain barriers that you have to break through in order to get this stuff mainstream. And that's why it's as hard as it is. And with promotion from social media being restricted, there's no reason. We see the reason why it's hard, and which is why we suggest for anyone of you guys listening, whether this can benefit you or not, we suggest to share this podcast, all these series, especially if you have a family member, loved one that you feel that is going through the repetitive cycle of certain symptoms, that there's question marks arising for them of other things that could potentially help. Obviously, we touched on many conditions, but it opens up the door for asking the questions at very least to physicians, or finding out other ways or other people that can potentially have answers for you.
Absolutely. And with that, that's all I got.
Hey, that was good.
But yeah.
And there's going to be a more regenerative medicine series comes down the road with more research, and we'll do an up-to-date as more literature comes to the forefront. You guys can pay attention to that as we keep going through, so make sure you subscribe for that reason. And if you feel like you're gaining knowledge, by all means, we're here to help out. So if you have any other topics that you want us to touch on outside of regenerative medicine, we're going to be definitely looking to dive into more as we go through to help for the longevity and purpose for influencing and bettering yourself moving forward. So,
Absolutely.
Doc,
As always, thank you, everybody. Until next time.
woo! Let's go.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.